Good morning, everybody. My name is Opeyemi Ayeola. I thought to just make this video, maybe it could help one or two people. Okay, so it's about medications that we use and whether prescribed or over-the-counter medications, and not reading, these mini leaflets or the pack of the medication that we go by. So I'm actually 100% guilty all the time, as long as my doctor or pharmacist or chemist gives me the prescription and tells me the dose, I'm fine. I never get to read the leaflet to find out side effects or precautions or anything at all. I'm 100% guilty, and this almost cost me my life and the life of innocent people. Now, I've been feeling, like everybody knows, I've been working back to back, non-stop for months now. And I can only thank God and wonderful producers, executive producers, directors who, over the years and months, have believed in my craft. So now, I've been feeling very low and a bit of under the weather. But, as usual, strong me, I'll just, brush it off and keep moving like a moving train, and like an unstoppable train. So about 2 days ago, I was on set and I was complaining of not feeling well. So everybody was like, "Oh, it's malaria symptoms, malaria symptoms." You know how we all just, diagnose ourselves of illnesses without necessarily going for tests to confirm. So I called a friend of mine who advised me to go buy a particular malaria over-the-counter malaria medication. So I went to the pharmacist on my way. I went to the pharmacy on my way home, and I got this particular malaria pack. So on my way home as well, I just stopped by and parked my car and drank a bit of curry because I've not eaten for a while. So just drank curry. Everybody knows I like to drink curry. I drink curry a lot, so it's like normal meal for me. So I drank curry and I used the medication there and then, the first dose, without reading the side effects or precautions or anything, which I never do. So yesterday I used, the medication is actually a 3-day course kind of dose. So I used the day before yesterday 1 tablet and 1 tablet yesterday before leaving the house. And I drove all the way from my house to Ikorodu to work, as not knowing that part of the side effects of that medication was drowsiness, dizziness, nausea, a lot of other things, and actually one could pass out. So I passed out twice at work. I just started feeling a bit dizzy, nauseated, and feeling very strange. So I excused myself to go to the toilet. I just passed out there on the toilet floor, and again I passed out on the bed. Then they quickly rushed me to the hospital. I'm actually still at the hospital, and I passed out again on getting to the hospital whilst they were trying to attend to me. So now, going back, we actually noticed, apart from other medications that I'm actually permanently on, we noticed that the malaria medication that I used was, could cause that, me to pass out, and, me to pass out, feel dizzy and all these things. And also now, looking back and thinking about it, I'm like, oh my God, to think I actually drove all the way from Ogun State, because I live in Ogun State. I drove all the way to Ikorodu by myself, endangering my life, not only my life, the life of the innocent lady that usually moves around locations with me, and the lives of other motorists and innocent people on the way, without, due to my own negligence. Number one, I never went for any test to prove that I actually was suffering from malaria. I just thought because I had these fever symptoms, automatically it's malaria. On getting to the hospital, I had no malaria, but I think I had traces of typhoid fever and all that. So, and also I didn't read the leaflet that came with the medication to warn me that I could feel dizzy and all these things that I felt, that that's led me to the hospital now. So this is just to encourage all of us, people who are actually like me, would never read, leaflets or packs of medications before using, and who are never careful of the side effects of a lot of medications that we all just go over the counter to buy, and also self, prescribed medication or diagnosing treatments just because you feel these symptoms, feel that symptoms. I've learned my lesson, and I thank God that mine didn't take my life or the life of innocent people.